Simpson, sir?
Yes, ma'am.
Yes, you can start, sir.
Okay. Okay. Good afternoon to all. Yesterday we were discussing about some of the physical fitness components and their activities related topics. Today, let us start from the physiological responses of physical activities. So, to move on from that, the effect of physical activity depends on various factors like level of training, fitness status of the participant, the previous status, how fit he is when he is starting his fitness course, then sufficiency of sleep. Yesterday we were discussing about the importance of sleep, importance of rest. So the sufficiency of sleep, the intake of coffee. Coffee it contains more caffeine, so it comes under the ergogenic aids. So the level of caffeine intake, alcohol consumption of the individual. Then the tobacco. Tobacco also comes under the ergogenic aids. It has some harmful effects. So next comes the general anxiety, psychological factor, anxiety. Anxiety is the fear of doing anything for the first time. So the level of anxiety also will have some direct impact on the effects of physical activity. If you are prepared for a particular activity, you may get good effect from that. If you are hesitating to involve in any strenuous activities or any type of training, the level of anxiety also will have some impact on this. So these are all the factors that directly influence or affect the effects of physical activity. Then the physiological effects, coming back to this physiological effect, the increase in heart rate. The heart rate of the individual will increase. The aim of the fitness trainer, is to reduce the heart rate of the individual. When you involve in training, first the heart rate will increase. After repeated training, we should attain the maximum heart rate. That maximum heart rate should be the goal of the fitness trainer. So the maximum heart rate should be attained through repeated activities, repeated exercises. That is why the training. So increase in heart rate will be the predominant factor in designing your training programs. So many studies have suggested the increase in heart rate when they are going for the checking. So when you check the heart rate of the individual before activity, if you are the resting heart rate will be less when you sleep or when you wake up in the morning. When you are asked to check the resting heart rate, when you are going for any physical examination, automatically it will sweep up. So the aim of the physical education teacher or the fitness trainer is to bring down the heart rate, level of heart rate. The maximum heart rate should be attained. That should be the goal of the trainers. Then comes the increase in stroke volume. Stroke volume. Yesterday we saw about the stroke volume. It is the amount of blood pumped by the heart in one beat. So the amount of approximately 5.6 liters we have. Average sedentary human being, they'll be having 5.6 liters of blood. Trained athletes, they may have some around 7 liters of blood. So the increase in the blood will depend on many factors. That level of training will decide that. So the stroke volume, the amount of blood pumped by the heart in one stroke, one beat, it should be increased. The stroke volume, when the stroke volume increases, automatically cardiac output also will be increased. So this blood which is pumped out from the heart will go to all parts of the body. That will result in the enhancement of performance, the fluidity of movement, everything will depend the amount of blood pumped by the heart. So sedentary people, they will have some around 60 to 70 ml of blood per beat. Whereas the highly trained athletes, they will attain 100 to 120 ml of blood in one single beat. That depends on the severity of the training, the nature of the training. Then increase in the cardiac output directly, when it is directly proportional. When the heart rate, when the stroke volume increases, cardiac output is also increased. Cardiac output is nothing but the stroke volume into heart rate. Here, the heart rate will be minimized. For trained athletes, the heart rate will be lower. But because of the strength of the heart walls, the walls of that, we are going to deal later. Yesterday also, we studied about that a little bit. We studied about the thickening of the walls of the heart. So when the heart rate reduces, the stroke volume increases for trained athletes. That will compensate. So this cardiac output, it may be increased due to the uh, reduced heart rate and also the increased stroke volume. Approximately 5 liters, average cardiac output will be approximately 5 liters per minute. It can rise to 20 to 40 liters per minute during exercise. So during the exercise, the contraction and relaxation of the heart, the pumping of the heart will be more. So it pumps more oxygen, more blood from the heart, which carries more oxygen. It will give the fluidity of the movement, the ease of the movement. So increased arteriovenous oxygen also. The arterial venous blood, the venous blood, the deoxygenated blood should also come out, and it should go to the lungs and it should be purified. So this also will be increased because of the stroke volume. Then next one, chronic adaptations due to chronic exercises, chronic regular activities, strenuous activities. That depends on the frequency of the training, intensity of the training, duration of the training, mode of activity, initial fitness status. So you are going for strenuous activities for some other competition, some level of competition. From college level you are going to the university level competitions. So at that time, the frequency of the training, how frequently you are involving in the training, how many sessions you are involving in the training, that depends the adaptation, chronic adaptation of the exercise. Intensity, how much intensity you are putting up. Yesterday itself we studied about the intensity. Intensity is nothing but the impact, how much effort you are putting on a particular activity. So that determines the adaptation of that effect of exercise. Duration of training, the total duration per session, how long you are going to do the activity, how long, 30 minutes or 40 minutes or 1 hour or 1.5 hours. The duration of the training, total duration of the training also will directly impact on the adaptations of the systems. Then the mode of activity, what mode you are doing. Are you doing in a closed setup, or are you doing in the outdoor setup, or are you going for any other altitude training, high altitude training? All these things will directly impact the adaptations. That is the effect of exercise. Then initial fitness status, the fitness status of the individual, how he is going to, what will be his. Already the strenuous exercises can be given those who have undergone some rigorous training only. So this, from the college level he is moving on to the next level, university level. So from the university level they may go for national level. From national level they will be going for international level. So that level, which level he is starting his exercise, which level he is starting his training, that also will have some direct impact on the effect of chronic exercises. The physiological values, physiological effects, when we see from the skeletal muscles which are attached to the skeleton are called the skeletal muscles. Here you can see the increase in the myoglobin content. Myoglobin content, that is from myoglobin content only we are getting the energy. It releases the stored energy from the muscles and which gives in, which is used for the regular physical activity. So the increase in myoglobin content will be resulted from the strenuous physical activity. Then increase in the concentration of important enzymes in the mitochondria. Mitochondria, as we study earlier, mitochondria is otherwise called the powerhouses of the cells. So they will be having the stored energy. The increase in concentration of important enzymes, which are helpful in the Krebs cycle. Krebs cycle, it is aerobic metabolism. Metabolism, as we already studied, metabolism is the process by which the food is broken down into pieces to give energy. That energy will be utilized for the regular routine of our activities. That energy will be used for doing physical activities. So to enhance these activities, the enzymes which are released from the mitochondria are very, very essential. So the concentration of the enzymes will increase in the mitochondria, which is called the power walls, which directly influences the level of performance. Increase in the number and size of the mitochondria. This also will have direct impact on the performance. The number of mitochondria in the cell will also increase. A slight increase we can see, and also the size of the mitochondria. The amount of the storage capability of the mitochondria are also increased in the cells, which directly impacts on the performance of the individuals. Increased capacity to oxidize fat. The major source for long duration activity is from fat. The main source we get for physical activities from the carbohydrate. When you go for long duration activities, when you go for some aerobic type of exercises, we need to burn the fat, which gives more energy. So the oxidation of fat will be increased due to the strenuous training process. Then coming back to the circulatory system, it consists of both this circulation of blood as well as the inhalation and exhalation also will be involved. So the size of the heart will be increased because of the strenuous activities. The increase in the size, it may be otherwise studied under this, like the walls of the heart will get thickened. The thickening of the heart walls will make the size of the heart bigger. The heart rate increases. The rate of the heart, the beating of the heart, the pumping action of the heart also will be increased due to regular physical activities. When the pumping of the heart increases, the rate of the heart increases, directly the stroke volume also increases. Stroke volume is the pumping out blood. Cardiac output. When stroke volume increases, cardiac output also will be increased. When stroke volume and heart rate are increasing, directly it helps in the increase of the cardiac output. The volume of blood, the coagulation, the blood density, we call density. The density also will be increased. The amount of blood also will be increased. We studied already. We saw that normal human beings, they will be having 5.6 liters. Average of sedentary people will have 5.6 liters, whereas trained athletes, it may be around 7 liters. The blood volume increases. The flow of the blood also will be increased. The flow of the blood is directly proportional to the viscosity of the blood. So the viscosity of the blood also will be increased. When the viscosity when the viscosity is lessened by the number of the increased number of red blood cells, the blood flow will be more. The blood pressure is nothing but the pressure exerted by blood on the walls of the capillaries and also the blood vessels. That blood pressure also will increase. When the blood pressure increases, automatically heart rate will increase. When the blood pressure increases, the heat of the body also will be increased, which will directly influence on the performance of the individual. Main changes in the parameters of this circulatory system is internal size of the left ventricle. Why the left ventricle? From the left ventricle only, the venous blood is pumped. So the size of the left ventricle increases. The contraction ability or strength of the heart increases. The strength, as we studied, the thickening of the walls of the heart gives more strength to the heart. So the strength of the heart increases. Resting heart rate decreases considerably. The resting heart rate, when you are not doing in any of the activities, the resting heart rate will vary differently among different athletes. Some long duration runners, long distance runners, they may be having around 35 or 40. They will be having around 40. They will be having resting heart rate at 40. So they will be involved when you select the athletes for long duration also activities also, you can consider this. So this should be reduced due to the training. Maximum heart rate either remains unchanged or decreases slightly. The maximum heart rate will have the direct impact on the individual. It's calculated by 220 minus the age of the individual. So that will remain unchanged. For some athletes, it will gradually decrease because of the strenuous training. The heart rate recovery period decreases. The recovery after severe training. For example, you are running a marathon race. After a marathon race, you may have some 1 or 2 days rest you should have for doing the next training. But trained athlete, they will recover faster. The trained athletes, the marathon runners, they will recover faster immediately after the competition. They will go for the next training. So the heart rate recovery period is less when compared to the normal human sedentary people. Stroke volume increases during rest. During the rest time also, the blood supply to the all systems of the body should be there. So the stroke volume during rest will be increased. So the flow will be increased. And sub or maximal exercise, subacute exercises and maximal exercises, it will increase gradually the amount blood pumped by the heart. No change in cardiac output at rest, because when you are going for strenuous activities, the heart rate increases. When the heart rate increases, the stroke volume also, the heart rate into stroke volume will result in the cardiac output. So there will be no change in the cardiac output during the rest time. Considerable increase in the cardiac output at maximum level of exercise. When you are going for peak performances, the cardiac output will increase. Blood volume increases as a result of increase in the plasma volume. Already I told you RBC, red blood corpuscles count. The red blood corpuscles count also will increase. The blood plasma volume also increases. So this will result in the increase in the blood volume. Then coming back to this viscosity, the thickness of blood, the viscosity decreases, resulting good circulation. When it is what to, the viscosity, if the viscosity is more, the drag force will not be there. It will not flow easily. If it is like a gel, it will not flow easily. If it is liquefied, the gel is liquefied, it will easily circulate and it will release more oxygen to all parts of the body. So the viscosity, the thickness of the blood will reduce due to the strenuous exercises. Blood flow to muscles increases. The flow of the blood to the muscles, whereas get the muscle directly, it will go to the each cells increase due to the more blood volume, effective blood distribution, and increased capillarization. So the blood will come out from aorta. From aorta, it will come to the blood vessels. From the blood vessels, it will also move on to the different cells through the capillaries, blood capillaries. So the capillarization will be increased, which results in better movement or better activities. Then reduction in resting blood pressure. The resting blood pressure already we have seen. The resting blood pressure will be reduced, both systolic and diastolic. Systolic relaxation, diastolic concentrate. So what we call pumping. Then higher cardiorespiratory changes. Cardio respiration. Already I told you, blood and circulatory system, it also refers to the cardiorespiratory system. So the higher maximal aerobic power, VO to max, the amount of oxygen, intake of oxygen, the more we intake oxygen, it will combine with the blood, and the blood will be oxygenated more and it will move to all parts of the body. So the higher maximal aerobic power can be attained through strenuous physical activities. Higher maximal ventilation. Ventilation is the cells also do respire. Each and every cell, they respire. That is called minute ventilation. Minute ventilation means the respiration of the internal. We call it as internal respiration. External respiration, what we do, inspiration, expiration. The minute, the internal respiration is a respiration inside the cells of each cells of our body. So higher maximal ventilation can be attained through regular strenuous physical activities. Increased blood flow to the active muscles. When the muscles are active, when the muscles are working, the increase in the blood flow will enhance the movements. It will give the precision to the movements. The movement will be easy. So for active muscles, we need more oxygen. From the more flow of blood, the muscles will get more oxygen due to regular physical activities. Increased ability to tolerate higher lactic acid level. So the lactic acid is considered to be the predominant factor in getting the fatigue, the tiredness. So the tolerance of lactic acid will be more when you go for repeated practices, repeated activities. So these are all the effects of exercise on cardiorespiratory system. What are all the changes happening in the muscles due to strength training, particular training, strength training? Because of strength training, we get the hypertrophy. Hypertrophy is nothing but the thickening of the fibers, muscle fibers, thickening of muscle fibers. So hypertrophy, we attain hypertrophy through regular strength training. Small increase in the number of muscles. Some what do you call, some recent study, they say that the number of muscles will be, the fibers, number of fibers will be increasing. The cells, when the fibers are increasing, the number of cells also will increase. So we can get a small increase in the number of muscle cells. selective hypertrophy of fast twitch fibers. We have fast twitch and slow twitch fibers. Fast twitch fibers are wave fibers. So they are helpful in the sprinting events. So selective hypertrophy of fast twitch fibers with an associated increase in the ratio of fast twitch to slow twitch. So fast twitch, we depend more on fast twitch muscles for regular activities, the day-to-day activities. So that fast twitch fiber will be getting more thickened. So the ratio of fast twitch to slow twitch fiber area will be attained through this training. More number of motor units. Motor unit is nothing but the joint connection between the motor nerve and the the nerve cell and the muscle cell. The number of motor units determine the activity, determine the pace of the activity, number of motor fibers. If the motor units, number of motor units, if the motor units are more in number, the activity will be enhanced properly. The activity will be faster. So this will depend on the number of motor units. More motor units will be attained through regular physical activities. Then benefits of musculoskeletal fitness. Size and shape of the body will differ. The size will increase due to regular physical activity, strength training and other training. The size and the shape of the muscle, they go for regular, when they go for this strength training, bodybuilders, particularly the bodybuilders, they want to increase the size of the muscle, size of the and also the shape of the muscles. They want the cuts to show off in the platform. So the body size and shape will increase. Sensory acuity, the number of motor units. So here again coming back to this, some number of motor units and a combination between the nerve cells and the muscle cells will be more. Then susceptibility to disease and disorders. There's occurring diseases. It is vulnerable to disease and disorders. If you are not doing any exercises, if you lead a sedentary life, you are easily prone to some diseases or disorders. So when you involve in regular training, the susceptibility will be less. You will not be prone to diseases or disorders easily. So this will help in the eradication of some diseases or the stoppage of occurrence of some diseases or disorders. Then functioning of body. The functioning of a body will be enhanced through regular physical activities. Recuperative activity. The recovering ability will be faster when you involve in regular physical activities. You can recover faster than the sedentary people. So recovery will be faster. Then ability to perform certain tasks, particular tasks, some activities of daily living, your activities of daily living, walking, running, jumping, everything, all the daily activities. What are all the activities you are doing for leading your life? Activities of daily living will be enhanced through regular physical activities. Then this musculoskeletal system. This musculoskeletal system depends mostly on the muscular strength, endurance, and flexibility. Strength is the ability of a muscle or group of muscles to perform a particular task, or the ability of a muscle or group of muscles to work against a given resistance. That is muscular strength. Endurance is nothing but the ability of a muscle or a group of muscles to work repeatedly for a given period of time. Endurance, long duration activities. The time will be specified. During the whole time, the muscle will be going on working without any undue fatigue, without getting tiredness. It should work for a long time. Flexibility can be the ability of the joints. It's nothing but the range of movements around the joint. This is determined by the ligaments of the joints, tendons of the muscles joint in the joints, and also the muscle density. Flexibility can be determined by all these things. So overall well-being and injury prevention. So because of the involvement in physical activities, regular physical training, the overall well-being can be maintained. The injury can be prevented through regular physical activities. The sprain is nothing but the rupturement in the tissues, rupturement in the tissues of the muscle that can be easily overcome by the regular training. If you are not involving in any of the training, without involving in any of the training, if you go for lifting more weights or anything, any strenuous activities, you will get the strain or sprain in the muscles that can be minimized by regular physical activities. You are prone to low back pain if you are not involving in any physical activity. If you are leading a sedentary life, you are prone to the low back pain. Osteoarthritis. Arthritis is nothing but the inflammation to the bone. Inflammation to the bone is commonly called as arthritis. Here, osteoarthritis is the covering of the bones, the particularly in the joints. They will have some smooth surfaces in the ends of the joints that will be inflamed. That is called the osteoarthritis. Osteoporosis, the muscles, the muscle deterioration, the bone also will lose the texture. The bone will be like that, the same, it will have the same shape, but the texture of the bone will be reduced. It will be reduced because of inactivity or some other deficiencies, nutritional deficiencies. The texture of the bone will be reduced. So most of the older people, geriatric patients, if they have a fall, they will have the fracture immediately. The bone will not be stronger bone. The bones will be losing its integrity. It will be losing the strength. So when they have a fall, immediately it may break. So that is the losing of the texture of the bone is called the osteoporosis. Instability of the shoulder. Shoulder is a complex joint. Shoulder, it's composed of many. Shoulder joint is what do you call shoulder joint. It The movement of the shoulder joint depends on many of the muscles, trapezius, deltoid, rhomboids, all these things. So any stiffness in these muscles or any problem in these muscles will result in the shoulder injury. So the shoulder injury can be minimized through regular upper body physical activities. So shoulder, it is a more common joint which helps in doing all the physical activities. So this can be this instability. Instability is nothing but the loosening of the joints. It will not be stable. It will be the stability. It will lose its stability. So that can be minimized through regular physical activities. The stability, the same as shoulder. Knee is also one of the complex joint. The whole body weight is borne in the knee joint. So that knee also will be losing the stability because of inactivity. So the strengthening exercises to the lower limbs will help in the stability of the knee. So we have to involve in regular physical activities. The obesity also may result in knee problems. So we have to go for regular physical activities to get rid of these knee problems. Then particularly the pain. Pain is a syndrome. It is not a disease. Pain is mainly a syndrome. So that syndrome can be eradicated through regular. If you involve in physical activities, yesterday itself I told you, when you feel the pain, you should know to differentiate the pain, is whether the pain is due to your training or due to some injury. If the pain is particularly in a particular point, like pricking pain, pricking with the pin or something else, you are injured. If the pain is pervasive, if the pain spreads to on the particular area, a whole area, it is meant that your system is adapting to the particular training. So the pain can be overcome. That syndrome can be overcome by the regular physical activities. Good athletes, they will not bear the pain. Some players, they will be going on playing. When they are playing the match, they will forget the injury also. They will not have the pain immediately after coming back, coming out of the field. They will feel the pain. They know the severity of the injury, like that. They will feel the pain only after coming back to the coming back from the ground only. So all these things will come under the well-being of the trained athletes. When you are involving in regular physical activities, when you are involving in regular training, you'll be having all these things. So next, physical activity and the aging. Aging is nowadays is considered to be a big problem in India. The aged person, they are not taken care of, the even the family members. So when you are aging, you have to take care of yourself. You will not have the support from others like previous years, our ancestors to serve the elders. Nowadays they are not helping the aged people. So aging is one of considered to be one of the problems in India. It is a complex process involving various factors. It's which process can never be avoided. We cannot avoid the aging process. Everybody in the world should undergo this aging process. So, how to overcome all these processes? How to overcome the aging through physical activities? As walking to the post, walking anywhere else, walking for day-to-day activities. If you go for a walk, like posting letters, nowadays we are not having letter writing habits. Walking to, at least walking to clean the garbages from the house to the end of the street. They can go and clean put the garbages out, or they can go for help the mm, family members in buying some vegetables or anything. They should have regular walk. That will avoid the inactivity of the aged people. Doing household tasks like the vacuuming, instead of mending and brooming the house, they can have the vacuum cleaners and they can do, or some other activities. Whole household tasks, what are all the activities can be done by them sitting on the chair itself, they can do some activities. So household tasks should be regularly done by the aged people. Digging your gardening, going to the gardening works will give, watering the plants, all these things will help in the physical activity of the aged people. So if you involve in all these activities, you can reduce the inactivity and you can be healthy and you can increase your longevity. And mainly the physical activities are performed to increase the longevity of the life. So that can all these things. Then aerobic fitness. Aerobic fitness, some aerobic activities. This aerobic activities will burn more calories. They can sit on the chair, they can move their hands, they can move their legs, can swing their arm, they can swing their legs, like that, anything they can. It helps in burning the calories, helping the aged people to stay trim without adding up more weights. Reduces the risk of heart diseases, coronary heart problems, or any other occurred heart problems that can be reduced due to regular physical aerobic activities. Aerobic means long duration activities. For them, long duration means not like 1 hour or 2 hours. Some 10, 15 minutes or 20 minutes may be considered to be the aerobic activity for the elderly people. Helps control joint swelling. So when you are moving, when you are swinging the joints, when you are moving your joints, the swelling will be reduced. The swelling is due to the edema, that is due to the inflammation, the storage of inflammation, the storage of lymphatic, the stoppage of the lymphatic circulation because of the lymphatic circulation. Since they didn't get the good flow of the lymphatic glands, they will have the inflammation in the joints. That inflammation will cause the edema. That edema will reflect as a swelling and pain associated with the arthritis. Arthritis, already we studied that it is the inflammation of the joints. Inflamed joints are called arthritis. So that inflammation can be reduced by swinging the joints or any rotations, circumflexion. All these activities will reduce the swelling, pain, and also arthritis. Reduces the risk of colon cancer, the bowel activities. When you do some physical activities, the metabolism will be there. Metabolism process will happen inside the body. The food will get digested, so you will not get the constipation or bowel problems. So the risk of colon cancer will be less when you are involving in regular aerobic activities. Will help you alleviate feelings of depression, alleviate, to stop, to eradicate, to reduce the feelings of depression because of stress. So they will have automatically, they will be neglected in the family. That neglection will give the depression to them. So when they involve in aerobic activities, they will get engaged themselves. They will have some sort of activities. They will help themselves in doing physical activities, which helps in reducing the fitness. It will helps in alleviating the feelings of depression. Then strength training. Strength training, they cannot go for strength training with the help of dumbbells, iron dumbbells or anything else. They can walking stick itself. Some activities, strengthening activities, the crunches or anything. So when you are strong, you are likely to experience a fall. When you are, the fall may lead to the some severe other complicated illness. So when you are strong, you will avoid the fall, and which leads in the major health risk of the ordinary. See, when they are going for attending their nature calls, they may fall. If they are strength, if they have their own strength to mobilize themselves, they will avoid these fall, which is not going to complicate in their life. So their strength training is must for them. They have to go for regular strength training with the help of their walking stick itself. Otherwise, they can simply close their fist and they can do the curls. Like that, they can sit on the chair. They can lift the leg up and down. They can swing the legs up and down. They can extend their knee, flex their knee, extend their knee, flex their knee. Both the legs, single leg, right leg, left leg, like that. They can do some sort of activity, strengthening exercises, which will have the suppleness of the muscles. The strength will not deteriorate easily. So the fall may be avoided because of this strength training. By exercising the strength, leg muscles, they will be able to maintain a good walking speed. The pace of the walking, the gait they can maintain through regular physical activity. The gait, the pattern of walking, all these things will be maintained by regular leg exercises. Then the tissue The tissues will burn more calories than fat. Muscle tissues burn many more calories than fat. Instead of fat, the adipose tissue, particularly before the conversion of fat, it will be settled down. The excess carbohydrate will be settled down as adipose tissues. It will burn and give more calories, so they can be able to eat more without gaining weight. If we go for some strength training, the adipose tissues will be converted as energy that will not settle as fat. So, if you are not doing any strength exercises, if you are not involved in strengthening exercises, it may be converted into fat, which can be stored in the body. It is very difficult to reduce the fat. They cannot go for regular physical activities, they cannot go for outdoor activities. So, they can convert the adipose tissues into energy boosters. So this will help in uh, eating more. Whatever they want to eat, they can eat. They can enjoy the food items without gaining weight. They can be able to cope up better in lifting, moving, all these tasks. They can do their own activities, taking the glasses, fetching the water, all these things they can do of their own without the help of others. They can do their own activities if they are involving in strengthening activities. Some main act diseases which hinders their activity are arthritis, cardiovascular diseases, cancer. Cancer, it's quite common nowadays. This is due to the inactivity. It is inactivity is considered to be one among the causes for cancer. Then diabetes. Diabetes quite common, not only among geriatric patients, it's common among the younger generation also nowadays. Then obesity. Obesity from the childhood itself, we are getting the obesity. So these are all the chronic diseases, common chronic diseases which the aged people are suffering. So to overcome all these things, they can involve themselves in some sort of physical activities. Primary health conditions affecting older adults, mainly the depression. Due to depression, they will not involve, they will not get any interest in doing any of the activities. The depression should be first, they have to come out of their depression. So, to come out of their depression, we have to talk to them, we have to repeatedly talk to them, we have to uh, they need some care from the family members. If they get the care which they are expecting from the family members, they can come out of their depression. Cognitive decline. Cognition is nothing but the ability to understand. So they will not understand that cognitive ability will be declining because of aging. Like small children, whatever we are saying, they will not understand unless otherwise they experience it. They cannot understand. The cognitive ability of the children will be less. Like that, they will be having the cognitive ability, but it will deteriorate. It will decline. The cognitive, they will not understand. Psychological problems will be more than physical or physiological activities. Psychological problems will be more for the elder people. They will not understand. They also have their life, they also have their family. Like that, it is very difficult to understand by them. Then pneumonia and influenza, any viral infections, any infection. Pneumonia is also considered to be a main factor for the elder people. Then oral problems, they cannot brush their teeth because of the fallen teeth. They cannot brush properly. They cannot go for oral hygiene. They cannot gargle properly. So the oral health problems also will be prevalent among the geriatric patients. Then some problems to the muscles because of osteoporosis. The stability of the bones will be decreased. The texture of the bone will be reduced because of aging, because of malnutrition. All these will happen. So orthopedic problems, they will have hip fracture. Hip fracture is the main cause for most of the bedridden deaths. If they have a fall, directly they will fracture their hip. If the hip is fractured, the medical professionals, they say some around 3 liters of blood will be wasted because of the hip fracture. It is very difficult to regain those 3 liters of blood. Already we studied that 5.6 liters for sedentary men. So because of aging, that may be somewhat decreased. That average level may be decreased because of aging. So when they lose some around 3 liters of blood, it is very difficult to regain the lost blood. Because of that, every activity will be affected. They will not move, they cannot move, they cannot do what they were doing previously. So they become bedridden. From that, if they recover from that within a couple of months, they will be okay. Otherwise, it is the the they will result in it, that bedridden condition will result in some other problems. So hip fracture is the common condition for the older adults. Aging process, how it affects, how this aging process can be affected in the individual. The skin, the main function of the skin is to protect our body, the protection of our body. Geriatric people, they will have the shrinked skin. The skin will lose its texture, it will be shrinking, the freshness of the skin will not be there, the dryness you can feel. So all these things will be an indication for some other complicated problems in the systems of our body. Because of other complications in various systems of the body, it will be reflected in the skin. So the layers, dermis, epidermis layers will be affected. Because of these, the venous circulation will be affected. The capillaries immediately after the skin, in between the skin and the muscles, that also will be affected. All these things will bring some other complications in their aging process. The musculoskeletal problem, the muscle mass, the mass of the muscle, the bulkiness of the muscle will be reduced. The mass will be reduced. When the mass is reduced, actually the number of fibers will reduce. When the number of fibers reduce, cells, number of cells also will be reduced. So the storing capacity of the muscle will deteriorate. When the storage capacity of the muscle is deteriorates, the functioning of the movement will be restricted. All these things will result in the malfunctioning of systems, various movements of different parts of the body. The respiratory function, inspiration and expiration, because of the lowered inspiration and expiration, the lung capacity, the lung volume, everything will be reduced. The loss of elastic recoil of the lung tissues. The lung tissues, it will contract and relax. The elasticity, contraction, relaxation, it will be reduced due to the aging process. Then cardiovascular diseases. Cardiovascular diseases are prevalent among the older people. At last, when the systems are deteriorating, each and every systems are malfunctioning, finally they will have the cardiac arrest. So in many of the deaths of the geriatric patients, the death certificate will be uh, died because of cardiac arrest. So cardiovascular system will be affected when other systems are not functioning properly. Endocrine and metabolism, the endocrine system, the endocrine, the enzymes, the secretion of enzymes will be reduced because of the malfunctioning of other systems. So when the enzymes are not produced properly, the metabolism also will be deteriorating. The enzymes which are necessary for the metabolism will be reduced and the metabolism will not be done properly. Neurosensory organs, neurosensitivity. Many of the geriatric patients, they will have tablets for the nerve functions because the depression. When depression comes, it directly affects the nervous system. When the nervous systems are affected, they will go for commonly they will go for neurobion or neuro tablets. That will affect the nervous system also. So the nervous system will be affected, which directly has the influence on the movement of various parts of the body. When the motor units are reduced, the movement of the muscles, movement of the organ, functioning of different parts of the body will be arrested. So that will have direct impact on the inactivity of the geriatric patients. The cause of this declination, how declination occurs in the geriatric patients. The muscle loss, the loss of the muscle, the bulky muscle will reduce in size, it will reduce in the number of cells, number of fibers, everything will be. Stiffness of the joints, maybe because of the reduction of the extensibility of muscle, the joint stiffness will be there. Because of inflammation or arthritis, joint stiffness will be there. Ligament failure, the ligament, the stretchability of the ligament will not be there. The ligaments are the uh, ligaments which connects two or three bones. That ligament will have the stretchability. That stretchability of the ligament will be less because of the deterioration of ligaments. So the ligament failure will lead to instability. They cannot stand properly, they cannot walk properly. So instability of the joints will lead to some fall. Injury propensity. They are prone to injury, any injury. If they get injury also, it will be very difficult to get healed because of the other complex processes. They will not be, the enzyme activity will be less, the coagulation process will be less, the viscosity of the blood also will be less. All these will result in injury propensity. Reversing the trend will be reversed. Again, they will not, they cannot do their regular activities. They cannot walk, they cannot run, they cannot sit there, they cannot stand. So the reversibility of trend will happen because of the aging process. Then the strength, they will lose their strength. The because of the muscle loss, the strength also will be lost. They cannot do their regular activities. Aerobic level of fitness, their level of fitness also will be deteriorating. So they cannot do any activities, any physical activities. Any movements will be restricted. The aerobic fitness level also will be restricted. Healthy habits and aging. So how to overcome all these things? How to get healthy aging? Have two kinds of fruits at breakfast as juice. You can have fruits as juices. We can make juices of two kinds of fruits. Fruit on cereal, sliced fruit, or a fruit salad. Fruit salad you can use, which can be digested easily. These fruits, they will not have more calories. So when you have limited calories, you can easily get digested. That can be easily get digested. It will also give some energy. As athletes or as a trainee, we need more breakfast. But during aging, you have to minimize the breakfast level. You can take some juices, fruits with the cereals, sliced fruits, or fruit salad. This will reduce the number of calories. The amount of calories will be reduced, which helps in easy digestion process. They will have at the same time they will have some energy for their activities also. Apart from lunch and dinner, you have some vegetable salads. As lunch and dinner, automatically the limit will be reduced. The amount will be reduced. Amount of lunch, amount of dinner will be reduced. With that, you can add some vegetable salads, which helps in easy digestion of the food, which are more in vitamins and minerals. Vegetable salad, which are more in vitamins and minerals, will help them to digest faster. Have two fruits or vegetable snacks daily. Snacks as snacks. Instead of junk foods, you can go for fruits or vegetables as snacks. Take multivitamin or mineral formula daily. Multivitamin either in the form of tablets or in the form of food. You can take multivitamins and also minerals. Particularly nowadays, it's now very difficult to take in the food form, so they are having in the tablet form, so they can go for multivitamin tablets or mineral tablets daily. That should be with the consultation of the doctors. Take a 30-minute walk daily, whether it is a walk in outside the house or some outside streets or anywhere else, wherever you get time, whenever you get time, have some walks. Walk up to a brisk 60 minutes. If you are able to do, you can increase the timing also. So lift weights while watching TV or talking on the phone. This already I told you. In the chair itself, they can do some exercise. Sitting on the chair itself, they can mobilize their joints. They can do some sort of physical activities, some strengthening activities. Canned food should be make convenient. So canned foods that food containers, that canned foods, they will have some weight. They can do with the canned food, do some activities, or bottles, water bottle. They can use water bottles, or instead they can have their own walking stick as the strength equipment. Quite smoking. Quit smoking. If you are aging, you have to quit smoking, which is injurious to health. This you can consult the doctor. You can go for counseling. It is psychological problem. So you can consult a doctor and how to come out of this smoking habits. Like that, alcoholism also, you have to get the consultation with the doctor. You have to go for counseling, de-addiction centers, whatever you are familiar with, you can do that. Get at least 7 hours of sleep at night. You have to go for sleep. It is very difficult for the elder people to get sleep, but you have to sleep for 7 hours. For that, you have to work your work properly so that you get sleep properly. If you sleep properly, exercise more during that. So there is when you exercise, when you mobilize yourself, you will get the tiredness and you may fall asleep. Get a flu shot every autumn. So during the autumn season, you can go for some what do you call primitive tips, some injections, some vaccines you can get at the time of autumn. To nowadays there are vaccines which we are taking in the childhood. It will last only for 40 to 45 years. So after 50 years, you have to go for the same sort of vaccines if you want to eradicate that, if you want to prevent that disease. So the flu shot should be given every autumn. Practice a deep relaxation program, meditation, biofeedback monitors you can use, massage, you can go for massage, or self hypnosis. So meditation you can do of your own, biofeedback with the help of some professionals. You can go for biofeedback monitors. Then massage, you can get the help of massage therapist. Self hypnosis you can, like meditation, you can do your of your own. So before going for this, you better consult with your medical officer doing everything. So if you have some problems, some respiratory problems, the inhalation, exhalation, the meditation, all these things will be hindering your other system. So better get the help of the medical officer before going for all these things. Spend more time with friends and family. So You can ease out your problems. You can talk out your problems. You can feel easy when you share your problems with your friends or family members. Those who are near and dear to you, you can share your problems. So spend more time with the family and friends. So this is the main problem in nowadays. They are not able to speak out what they think. The elder people, they are not able to bring out what they have in their mind. They don't have anybody to at least talk to them. So that is a bigger problem in Indian families. So spend more time with friends and family. Uh, if your friends or spouse, your wife or husband, if they say lighten up, do so. So you bring out, you come out with your problems. You don't get side, you don't have anything in your mind. You bring out your problems like that. If they are giving suggestion, if they are ready to help you, you please open up, you lighten up to them. Get a dog or cat. Some pets will have some effects. Some many of the houses they have the fish tanks. When they feel nervous, when they feel depressed, they go out and sit near the fish tank. They, when they see the movements of the fish, they will relax themselves. Like many will be having many different activities. Listening to the musics will alleviate the depression. Like that, you get a dog or cat which will be with you for all the time. When you need something, when you need some time to spend, you can spend with the pet animals. So volunteer in a program that helps those less fortunate than you. So you can volunteer yourselves to help some others. The same thing, neighbor is also not having anybody to talk to them. So you can have programs, you can arrange programs, you can go and meet him or let him come and meet. Like that, you can have volunteer programs and do something to the others, poor and needy. Enjoy regular sex. This very difficult. If they are a couple, they can have, they can exchange some cuddles or anything. It is very difficult if they are alone. So seek out opportunities to laugh. So whenever you feel to laugh, you laugh. You, whenever you just smile, instead of smile, you can laugh aloud. It will alleviate the depression. uh, then run comedy videos, some programs which you like, which you are interested, you involve in that program, you see the program, you go through the program or attend some comedy shows. Many shows nowadays, many theaters, open air theaters are there. They can go there and they can have their time spent. Count your blessings daily when you wake up and before you go to sleep. This is very, very important. The daily, when you get up, you think of the previous days. When you are going to bed, count your blessings from the morning. What blessings you have got? You forget about the negative things. You think of the positive things, the blessings which you have got. You think of that. When you are waking up, you think of the whole month, the whole week. What are all the things? What are all the blessings you have got? The whole year. What are the blessings you have got? Waking up in the morning itself is a blessing. So that, think of that and you act accordingly. Physical activity and life expectancy. So we involve in physical activities just to increase the lifespan only. Just for the longevity of the life, we are involving in some physical activity. So for men 50 years or older, moderate physical activity levels lead to 1.3 years more in total life expectancy. Moderate level of activities. It helps in 1.3 years more, and 1.1 years lived without cardiovascular disease, without any diseases. 1.3 years more and 1 year, 1 month without any diseases. The moderate activities, high level of physical activities will add 3.7 years. This can be expected in your lifespan. This is the expected value. This is not the exact value also. And 3.2 more years, 3 years, 2 months without cardiovascular disease. For women of 50 years or older, moderate activity will lead to 1.5 years, 1 year, 5 months. 1 year, 3 months without any cardiovascular diseases. High level of physical activities will add 3.5 years, 3 years, 5 months, and 3 years, 3 months without any cardiac diseases. So this is the expectancy due to physical activity, due to regular physical activities. This cannot be taken as hard. This is only the expected values, expectancy. Then next we will move on to the nutritional status. Nutritional status, mainly the nutritional status can be assessed by the mnemonic A, B, C, D. So up to this, we have studied about the physical activities, fitness, effect of physical activities on various systems of our body, like muscular system, cardiovascular system, circulatory system. All these things we have studied. Now we are moving on to this nutritional values. Nutrition, what impact does nutrition have on the individuals? So the assessment, first we will see the assessment. This is assessed by the mnemonic A, B, C, D. Anthropometric measurement, biochemical or laboratory test, clinical indicators, and dietary assessment. So all these will come under this nutritional assessment, nutritional status assessment. This is by the clinical examination. Then how to plan a menu for breakfast, for lunch, for dinner. How to plan a menu? We have several techniques. We have different techniques. The main principles, the main factors are strive for balance. You should have balanced. So before going to that, we'll slightly look onto this anthropometric measurements. Anthropometric measurements are nothing but the body mass, linear dimensions, height, body composition. All these will come under the anthropometric measurements. Height, body mass index, height by weight, then waist hip ratio, body fat percentage. There's all these things we studied earlier itself. So this we will give the chart will be given in your notes itself. What should be the ideal measurement for this? This all these they have studied differently. They have done different researches. From the results of the researchers, they have given something, but it will not be appropriate and when compared to the Indian setup. All these what you call body mass index and other things they have studied with the help of the foreigners only. And I don't think many of the researchers none of the researchers have been done in India. We have no average for this, so we cannot rely on all these measurements, particularly to our Indian standard. So we can, as a notes, we can take it as a guideline. We can take it as for our understanding only. We have to do some researches on these anthropometric measurements that will give the average values in Indian setup. So we cannot rely mainly on these things. Okay. So biochemical tests or laboratory tests that that also they have given some standard for hemoglobin, urea, uric acid, total cholesterol, high density lipoprotein, low density lipoprotein, triglycerides, very low density lipoprotein. All these things they are given. These also the physiology differs individual to individual. All that cannot be averaged. That that depends the nature of the activity, topological factors, many factors we have to take into considerations. Dietary assessments also, diet, the vegan diet, we have vegan diet, vegetarian diet, pure vegetarian, that vegan, and then non-vegetarians, all these things will come into play and go for the further studies. So next, planning a menu. First, strive for balance. Balance all the components. So, what are all the components we need? It should be there. Previously, we studied 3 is to 2 is to 1. 3 portions of carbohydrate, 2 portions of protein, 1 portion of fat is ideal for training. Like that, you have to look for balance. You have to go for carbohydrate, vitamin, mineral, protein, fat. All these things should be taken into consideration when you are going for a menu. Emphasize variety. The variety should be more. You should go for different varieties: cooked food, uncooked food, vegetables, cooked vegetables, uncooked vegetables, cereals, pulses, everything. So the variety of food should be some milk products, dietary products. All these things should come into play. So the emphasis variety should be emphasized on the diet which you are planning. Or contrast, the contrast should be there. Contrast means not only in contrast in color, not only contrast in cooking, non-cooking, other things also should be taken into consideration. That texture of the food, flavor of the food, everything should be taken into consideration. For chapati, we will go for some what do you call, gravy. The same thing with rice, we will go for some dal fry, chapati dal fry, rice with gravy, like that. The contrast should be there. Think about color. Color means mainly we can go for the vegetables and the fruits. The color should be there. The color of when you go for salads, vegetable salads, we can have different colors. So the color which should be for the hotel industry, they are concentrating more on the colors. The presentation, they give more importance on the presentation. Consider eye apple. So the when during the presentation, how they are going to present it. What is the eye appeal? How the eye appeals to that. Seeing the food item itself, we are having the thirst in our mouth. The juicing of water in the mouth will, is called the appeal of the eye. So that should be taken into consideration. That presentation techniques they use more in the hotelier industries. So all these things should be taken into consideration when you are planning for a menu. Then nutritional deficiencies, the common deficiencies because of malnutrition, anemia. Anemia is a common term, is quite common in Indian, particularly women. The content, hemoglobin content will be less. The number of red blood cells will be really less because of this anemia. So they should overcome, because due to this can be overcome only by the nutritional values only. Then beriberi is also a disease caused by the vitamin B1 deficiency. Here the it mainly affects the skin and the bones of the small children. Osteoporosis, as already we studied, the texture of the bone will be reduced. Pellagra is another one disease because of the deficiency of B3, vitamin B3. Then rickets commonly found in children because of the deficiency of vitamin D. So these are all the common nutritional deficiencies. Then coming to this toxin, food, how the food is, how what the toxins in the food. Slides are not there. They have given all the tabular columns with the values, specified values for different items. You can go through that. What is necessary for our food? What, how much vitamin, how much minerals? All they have given in the different columns. You can go through that. Then toxification of food will go on to the toxins. Mainly they call the seeds of the fruits, they have some toxins in it, especially the apple seed. During the childhood, they will avoid the seeds of the apple. It has the toxic quality. It will lead to some digestive problems. Then yes,
Sorry, sir. I
tell
think
me.
this slide is not moving.
No. Slide is not working. Slide, that's all. Food toxin,
Oh,
that's all.
okay, sir. Okay.
Okay. So I told them to go through that slide, that tabular columns. Okay, then the seeds. The sweet potato. Mm, when it is getting dated, some notes will grow from that. That notes have the toxic quality. Even the potato itself, when you are not using the potato for longer time, 2-3 days, if you keep the potato, it will, the greenish color, we will get the greenish color. Then we also see some notes developing from the potato that leads to the toxic quality of the potato. Like that, kumara is one among the, it also is from the potato family. It is a sweet potato. In that also they are having this notes. The development of notes will lead to the toxic quality of the food. Some cattle feed on these kumara. They get some problems because of this. Then parsnip is commonly group of natural toxin known as furocomorin. This also is like what it is also a food substance which directly affects the digestive process of our system. It affects the stomach, particularly stomach part. So whatever problem, digestive problems we get, it will directly reflect in the stomach ache. Potato we have already seen. Kidney beans also, they have got some toxins. So this beans, they, before cooking, they will process the beans. They will dry this kidney beans. Many use after drying the kidney beans. it also will be resulting in stomach ache or vomiting or diarrhea. So instead of dry beans, if you are using fresh beans, first they will soak the beans in water. They will soak it for some 3 to 4 hours. After that only they will go for cooking. Then rhubarb also has the oxalic acid. They will be directly acting on the muscular system, muscles. The muscle ache will be there. They will have the cramps. They'll have the vomiting sensation, feel headache like that. It will affect. Then zucchini may also contain a group of natural toxins. And bamboo shoots, cassava and bamboo shoots. Bamboo shoots they use for cooking. Not they will keep something inside the bamboo shoots and they will cook. That also will reflect in some problems in the body. Honey, toxic honey, honey is produced from the bee. Some kind of some bees they will segregate some toxic substances from the flowers and they will segregate the honey. That will lead also to some problems in the human beings. So fresh foods and vegetables, it is better to have fresh foods and vegetables as diet. It will help in detoxification of the fruits and vegetables. So if you take fresh fruits and vegetables as salads, it will be helpful in reducing the toxins and detoxification. So it is better to have some 5+ servings of fruits and vegetables per day. It is recommended by the Ministry of Health, 5 to more than 5 servings. So normally as Indians, we have 3 servings of food: morning breakfast, afternoon lunch, evening dinner. So before the in between breakfast and lunch and in between lunch and dinner, we can have some snacks. Instead of some junk foods as snacks, you can have some servings of fruits and vegetables, which are helpful in detoxification of the whole body. They also help improving the metabolites of the body, which results in better metabolism, better digestive processes. So here they have given some of the toxins, types of toxins. Heavy metal toxins. Heavy metal toxins like lead, mercury, cadmium, arsenic, nickel, and aluminum. These metals are all these will lead to the Alzheimer's disease. Liver toxins. Liver toxins, mainly the liver. Liver is the filter for our body. So it filters all the toxins, it all filters all the unwanted products from the body. So this liver, if the liver is malfunctioning, the toxins will directly enter into our body. So the pesticides, mainly the liver is affected by the tablets which we are taking. The tablets will not only have the needed medicines in it, it also will have some toxins in it, some added toxins in it, which also will result in the damage of the liver. Then microbial toxins. This category of toxins include the product by unwanted bacteria and yeast in the gut. which can be absorbed and cause a significant disruption of bodily functions. So the unwanted bacteria, some useful bacteria are also there in our body. Some unwanted bacteria and yeast uh, like it's a fungus. So they also will produce some toxins which result in the ill health of our body. So to prevent this, you have to go for food rich in fiber, especially water soluble fibers. We have to take more protein by product toxins. So protein, excess of protein also will lead to malfunctioning in the digestive processes. That also will directly affect the kidney. So the excess of protein also should be avoided. This also will become a toxin to our body. So that should be avoided. It is mainly by the urea, which are the mainly by what you call ketones in our body. Number of ketones will be increased because of this protein. This will directly affect the kidneys. Then toxic effects of food. So all these toxins will directly affect the digestive system of our body. From the digestive system only, we will get other complications. When it goes inside, it will get digested, it will be circulated by the to various parts of the body through the metabolic process. So when it goes out, it gives many problems like headache, stomach ache, giddiness, vomiting, irritation, bowel irritation. All these things will be the effects of these toxins when it is consumed. Then food sensitivities. Some will have some allergies to some of the food items. Some they will not, when they take allergic food, some will be allergic to some particular uh, vegetables. For example, brinjal, if they eat brinjal, they will get the itching sensation. So that is allergic to them. Some they will get, they will be allergic to the meat items. If they take meat, they will have some swelling on their hands or some other problems, some physiological problems also they will get. They will get diarrhea, they will get vomiting. So meat allergy some will be having. Some will be allergic to the coloring substance in the ice cream. They will be fond of ice cream, but the coloring substance in the ice cream will lead to some other problems. That will be thickening of the lips, thickening of the muscles in the face. All these things will be due to the coloring agents or some other chemicals which are added in the food. Some are allergic to coffee. The caffeine, coffee and tea, they will be allergic to them. The most common offenders for tubes, ovaries, and uterus are coffee, tea, cane sugar, wheat, corn, milk, beef, egg, chicken, and pork. So these are the main allergic foods for the particularly for the women who are having the what you call it, uterus problems. For these uterus related problems, these are the allergic agents. Many of the sign and symptoms of all these allergic agents are headache, depression, agitation to the PMS, premenstrual syndrome. All these things will be because of these symptoms of these allergic foods to the persons with uterus problems. Then addiction, food addiction. We are, or some other the way we are addicted to something else. So main addiction is this coffee or tea. So this we are taking as a ergogenic aid. Coffee and tea we are taking as a booster, but the toxins in that may lead to some other problems. Then food contamination of food. Uh, the food which we are taking inside, they will be broken into pieces. Whatever food we are taking in, it will be broken into pieces. Those pieces will become the microbes. Now microbes will give the desired effects on the systems, various works they are doing, like growth, everything they are helping in the process of growth and our growth and development of all our organs. So these microbes, they may have some ill effects on the body systems. Because of contamination, they may result in a contamination of water, contamination of food, some food items. They easily get spoiled because of contamination. So all these contaminated food also will affect the overall health of our individual. Water contamination is the main contamination in in India. Previously, we had drinking water from the rivers, the flowing waters. From the flowing waters, we collected water and we used to do this. Now we are using the can water. We don't know how the can water is processed. So the contamination that water contamination is the main problem in India. Like that, all the food, rotten vegetables and rotten fruits are used for making juices. So some other packed juices, they are we don't know how it can be contaminated. So the outdated foods, everything we are taking, and it has some ill effects on the body. Milk products, dietary products, all these also will be having some effects on our body. So better to avoid packed foods. It is always beneficial to take fresh foods. If you get the meat also, meat also, you don't know when the meat was taken, how it was preserved. If you go for fish, the fish, they are using some chemicals for fermentation. So all these things will contaminate the food and it will have the direct impact on our body. So the common problems: stomach upset, abdominal cramps, nausea or vomiting, diarrhea, fever, dehydration. See, these are all the symptoms of using the contaminated food. So these will reflect. This may be due to the bacterial infection or the fungal infection in the food. Contamination can be caused due to bacteria or fungal infections. Anything may happen, and it will directly impact on the body systems of our body, particularly in the digestive system, which reflects as a symptom to various other allergies. Then pesticides, mainly the pesticides. Nowadays we are using pesticides for growing the food for better result, for getting better result. We are using the pesticides. These pesticides, they direct impact. The studies, many of the studies, they say that these pesticides directly impact on the nervous system of the human beings. So apart from the digestive system, it also affects the nervous system. So at the age of at the younger age itself, they are having the nervous problems because of pesticide grown foods. So these can be avoided. Then foodborne illness, causes of foodborne illness. The harmful bacteria are most common cause of foodborne illness. Bacterial infection only causes more. So foodborne illness are prevalent in the stored foods, refrigerated foods. So the symptoms of illness are abdominal cramps, nausea, vomiting, diarrhea, fever, dehydration. So it is not advisable to give the refrigerated food to the children. So in this modern world, we have in this busy world we have changed the lifestyle. We are using most of the canned foods. We are using most of the refrigerated food. So all these can be rectified. All these can be avoided, and we can go for healthy living. Food safety nowadays they are doing safety. They have some factory made foods. They are producing some bacteria and they are killing the bacteria, unwanted bacteria like that. They are processing the food in many different ways, but we don't know how far it is going to work out. It is better to avoid the refrigerated foods. It will be better. Then vegetarian diets. Vegetarian diet also plant diets. They are called the vegetarian diets are vegetarians are also classified into two types: lacto vegetarian, strict vegetarian. Lacto vegetarian, uh, they will take dietary products. Strict vegetarians, otherwise called vegan diet, they call vegan diet. They will not even take the dietary products also. They consume only the fruits, vegetables, nuts, seeds, like that. Plant vegetables only, plant food only they will take. Vegan food behavior. So all the components of food items they are given. You can go through that. The non-nutritive food we call it as fat diet foods. So I think it's over. So you can go through this given handouts, notes. You can go through that. Hope you all understood.
Yes, sir.
Yes, sir.
So all these nutritive values and other things they are given separately in that tabular columns. You can go through that. I hope you are all having that handouts, no? The printed materials they have sent you, no?
Yes, sir, we have.
Okay, you can go through that. So today I think we can wind up the class.
Thank you, sir.
Okay, thank you all.
Sir, சொல்லுங்க சார்.
சார்
சார் நாளைக்கு அந்த கிளாஸ் எடுத்துரு. இன்னொரு இது இருக்கா, நாளைக்கு போட்டுமா சார்? அது உங்களுக்கு இன்னொரு சப்ஜெக்ட்.
ஆமா
எக்ஸசைஸ் பிரிஸ்கிரிப்ஷன் ஃபார் ஸ்பெஷல் பாப்புலேஷன். கரெக்ட்டா சார்?
Okay.
நாளைக்கு tomorrow other students listen to me. Okay, tomorrow sir will be available 2 p.m. to 4 p.m. The other subject called exercise prescription for special population. Okay. Thank you, sir.
Okay, thank you.